It's almost hard to believe that caretaker serial killers exist. Unfortunately, they do. Healthcare workers who are serial killers have access to a lot of different ways they can end someone's life. Most use poisons or overdoses to kill their victims. In this video, we will do a case study of serial killer nurses to see how and possibly why they killed their patients. This examination of killer nurse case studies will be applied to the Lucy Letby case as to how and possibly why she killed infants in her care. Janine Jones was a licensed vocational nurse during the 70s and 80s. It is believed that she killed around 60 infants and children in her care while she worked in the pediatric intensive unit at the Behar County Hospital, which is now the University Hospital of San Antonio, Texas. Jones injected her victims with digoxin, heparin, and later succinylcholine. Digoxin used to treat heart failure and certain types of irregular heartbeat. Symptoms of digoxin overdose: life-threatening arrhythmia, organ dysfunction, renal failure, shock liver, altered mental status, significant hyperkalemia. Heparin prescription medicine used to treat and prevent the symptoms of blood clots caused by medical conditions or medical procedures. Symptoms of heparin overdose: excessive bleeding and life-threatening blood loss can occur quickly. Patients who receive heparin should be monitored for internal bleeding. Succinylcholine skeletal muscle relaxant for IV administration indicated as a general anesthesia to facilitate tracheal intubation and provide skeletal muscle relaxation during surgery or mechanical ventilation. Symptoms of succinylcholine overdose: prolonged apnea, neuromuscular block beyond the time needed for surgery, and anesthesia often leads to potentially lethal respiratory paralysis. Psychological examination of Jones's behavior and incidences of odd behavior. Likely suffered from histrionic personality disorder. Became uneasy if she wasn't the center of attention. Had a tendency to wear inappropriately seductive clothing and brag about her alleged sexual conquests. Tended to make dramatic public displays of grief and crying over the infants it turns out she murdered. Reportedly made a huge histrionic display of grief at her brother's funeral. Was observed singing to an infant's corpse as she prepared it for delivery to the morgue. Once joked, "They're going to think I'm the death nurse." Insisted on carrying dead babies to the hospital morgue herself. Seemed as though infants in her care seemed to constantly require her resuscitation. No motive has been established, but it is believed that she killed to make herself feel important in the midst of medical crisis. Beverly Gale Ellett killed children while she worked at Grantham and District Hospital, Grantham, Lincolnshire, England. She was convicted of murdering 4 children, attempting to murder 3 other children, causing grievous bodily harm to a further 6. She did all this within the 59 days she worked at the hospital.
A girl that's about 21 years of age, never been in trouble with the police. She gets all of these charges. She's laughing. She's happy about them.
Insulin, a hormone created by the pancreas that controls the amount of glucose in your bloodstream. Overdose: create a dangerously low glucose level in the blood.
We are now arresting you for the attempted murder of Paul Crampton. This child has been given a deliberate injection of insulin from which he could have died. I believe you gave it to him.
Okay.
In fact, this child has been given 3 injections of insulin on each occasion, and on each date was alone with him shortly before he suffered his hypoglycemic attacks. Yet again, this is not a coincidence, is it?
No reply.
Exhibited symptoms of Munchausen syndrome and Munchausen syndrome by proxy. As a child, she would wear bandages and casts over wounds that she used to draw attention. Often showed aggression towards others. Spent time in hospitals seeking medical attention for a string of physical ailments. Known to self-harm and had to resort to doctor hopping as medical practitioners became familiar with her behaviors. A past boyfriend said that she was aggressive, manipulative, and deceptive. Claiming false pregnancy, as well as rape, before the relationship ended. After incarceration at a mental health hospital, Beverly ingested ground glass and poured boiling water on her hands.
Smiling. Is it funny? Is it light-hearted? Don't you take the interview serious?
No, why?
I don't think it's funny. I'm sure there's 12 sets of parents down there. Parents who were prepared to offer you the responsibility to be godmother to their children. Parents of children you murdered.
Have you got any feelings for them at all?
No reply.
Jane Talpan. Jane grew up in Boston's female asylum, where unwanted children were often abandoned. Jane was fostered as an indentured servant until the age of 18. She continued to work for the household until Lady Talpan's death. After which Jane attended Cambridge Hospital in 1885 to be trained as a nurse. She was well liked at the hospital and was eventually given the nickname Jolly Jane. She worked at Massachusetts General Hospital, where she claimed more victims before being fired. She then returned to Cambridge and was soon fired for administering medication recklessly. Soon after, she began working as a private nurse. Among Talpan's victims were her landlords, doctors, nurses, friends, and elderly members of families she worked for. Talpan was arrested on October 29, 1901. After her arrest, Talpan confessed to 31 murders. She was found not guilty by reason of insanity and committed to life in the Taunton Insane Hospital. Jane Talpan would experiment on patients with morphine and atropine. She would alternate the doses to see what effects they had on the nervous system. It is believed that Jane's first victims was her landlord and his wife. She also killed her foster sister using strychnine. She killed a wife and her husband while she worked as their private nurse. Within weeks of killing the husband and wife, she killed their 2 daughters and the husband's sister. Methods of killing. Strychnine, a white, odorless, bitter crystal in powder. It is a strong poison. Symptoms of strychnine poisoning. Muscles throughout the body have severe, painful spasms. Eventually, the muscles tire and the person is unable to breathe. Morphine and atropine. Morphine acts on the central nervous system to relieve pain. Symptoms of morphine overdose. Morphine overdose patients become very tired, stop talking, and eventually become unresponsive. Breathing may become shallow or even stop. Atropine used to treat certain types of nerve agent and pesticide poisonings, as well as some types of slow heart rate, and to decrease saliva production during surgery. Symptoms of atropine overdose. Respiratory, depression, coma, circulatory collapse, and death. Odd behaviors of note. Talpan was said to have falsified documents to keep patients at the hospital for longer stays so she could get to know them. It's said that Talpan had a strong dislike towards elderly patients, feeling they were useless and not worth medical attention. She would often use various drugs on her elderly patients, often gradually upping the dose until her victims died. She would also stage sickness with poison and use this as an opportunity to nurse the patients back to health. Talpan was said to have stated that she derived a sexual thrill from patients being near death, coming back to life and then dying again. It said that Talpan told her attorney that she would often get into bed with her victims as they convulsed. She also described her motivation as a paralysis of thought and reason, a strong urge to poison. Talpan would even poison herself to evoke the sympathy of men who courted her. This video is a case study analysis of how and why serial killer nurses have killed. Analysis of strange behavior and confessed motives is the key to understanding why a person has become a serial killer. Medical analysis like toxicology reports, medical examination of symptoms, and autopsy reports are the key to understanding how these caregiver serial killers have killed. The 3 cases discussed were selected from the numerous amounts of serial killer healthcare workers that exist. If found guilty, Lucy Letby will be the newest member to join this gruesome club. What could have been her motivation? 2 of the 3 cases previously discussed in this video led to incarcerations at an insane asylum, and 1 was convicted and sent to prison. But why? Jane Talpan claimed to have a compulsion, but Beverly Ellett had a visible compulsion. In just 59 days, Beverly killed 4 children, attempted to murder 3 others, and caused bodily harm to 6 more. Jane Talpan is believed to be one of the first serial killers in American history. If she was tried and convicted today, I believe she wouldn't have been sent to an insane asylum. Jane's motivation is consistent with a sexually based motivation that is normally seen in male serial killers. A sexually based motivation often includes thrill and power along with lust. Jane did not kill her victims to gratify her need for attention. However, Beverly and Janine did. Janine Jones is believed to have histrionic personality disorder. Like Beverly, Janine used murdering children as a way to gain attention from others. However, unlike Beverly, Janine had a history of displaying exaggerated behavior, among other symptoms associated with histrionic personality disorder. Beverly had an extreme case of historical incidences of Munchausen syndrome behaviors before and after her incarceration. When Beverly was given the opportunity to reflect her Munchausen syndrome by proxy, she showed a significant compulsion and lack of concealment when committing her crimes. I believe that more than most serial killers, Beverly does belong in an asylum. Without reading anything about Lucy Letby's court case, I would have guessed that she suffered from Munchausen syndrome by proxy but would not be deemed insane. So as of today, what would Lucy Letby's entry into this book look like? Lucy Letby. Lucy is accused of 22 charges, which concern 17 different babies. She's charged with murdering 7 babies and attempting to murder 10 others. Her trial began on October 10, 2022. After Lucy began working in the neonatal unit at the Countess of Chester Hospital, the statistical deaths in the neonatal unit rose significantly. It's been stated in court that Lucy was moved from the night shift to the day shift. This move corresponded with the rise of deaths on the shift she worked and a decrease in death on the shift she left. Lucy is believed to have been present when all 17 of the babies were allegedly harmed. Methods of murder. After a medical explanation couldn't be determined, police began an investigation which suggested that 2 of the children were poisoned with insulin. 2 more children, one of which had died, are believed to have been harmed by air being injected into their bloodstream. A mother of a victim told the court that she walked in on Letby attacking her child. The child was distressed and bleeding from his mouth. This child died 5 hours later. A doctor present said he had never seen a baby bleed like this. The child lost more than a quarter of his total blood volume. Cause of death was wrote down as gastrointestinal disorder and no postmortem was taken. Later, it was concluded that gas was intentionally injected into his bloodstream. Lucy allegedly injected a baby with air through a nasogastric line to his stomach. It is believed that she tried to kill a child 3 times by injecting milk and air into her nasogastric tube. This baby survived but is living with irreversible brain damage. Odd behavior. Evidence has been shown that Lucy used her computer numerous times to look up families of her alleged victims on Facebook. She allegedly falsified medical records, which were used to cover her tracks. Lucy allegedly removed a mother's visitation from medical records. She also changed medical records to say that she was in another room when a victim collapsed when she was in fact in the room. Lucy allegedly had to be asked to leave a grieving family alone so that their assigned nurse could attend to them instead. Lucy allegedly sent a sympathy card to one of the baby victim's parents. She took an unusual interest in twins. She would search for families of twin victims on social media. She conducted these searches over several months and even on Christmas Day in 2015. This baby's twin brother was allegedly attacked by Lucy, who was said to have laced his feeding tube with insulin. This attack was administered less than 24 hours after his twin had passed. Luckily, this baby survived. Allegedly told a friend she wanted to see a living baby in the space that had previously been occupied by a dead baby. While nurses were failing to resuscitate a victim, Lucy allegedly told a colleague, "He's going." Allegedly searched for a victim's family on Facebook shortly after his death. The timing suggested that she may have just woken up. At least 3 sets of twins were attacked by Lucy, where sometimes one twin would live and another would die, but all 3 sets were attacked. Lucy Letby's diary entries and notes. She had made a note of an incident where brain damage was found in scan of child M. "I don't deserve to live. I killed them on purpose, because I'm not good enough to care for them. Not good enough, I will never have children or marry. I will never know what it's like to have a family. I am a horrible evil person. I am evil, I did this." What allegations have been made and by who? Do they have written evidence to support their comments? Text messages. After her alleged first victim passed, Lucy texted a colleague saying taking the baby to the mortuary was the hardest thing she has ever done. It was awful. He died very suddenly and unexpectedly just after handover. Not sure why. Allegedly text messaged a colleague to say it would be cathartic to be in a room where a baby had died. Said she texted a friend that she had a mini meltdown about what's happened at work. Haha, nodding off in cinema isn't a good look. I had a mini meltdown last night about what's happened at work. I just need some time off with mom and dad. If I could have any information about this case, I would pick a professional psychological diagnosis of Lucy Letby, but as of right now, I do not have one, so let's speculate. What motivates Lucy? What is she getting out of these alleged acts? I believe anger towards herself is present in her notes. I believe seeking attention is in the messages she allegedly sent her colleagues. This to me is a big red flag. She seems to communicate about the children's deaths a lot. She often talks about how horrible it was for her. Other than the text messages so far, there hasn't been much information to indicate that she had a history of seeking attention through harmful or unharmful means. There is, however, a significant amount of information that points to the idea that she enjoyed being involved with the grieving family. She would often look up the families of her alleged victims. Perhaps she enjoyed thinking of what she did to the family, maybe she enjoyed causing emotional pain in others. It is never mentioned how she acted after or during a medical emergency, which is one of the high points for a sympathy and attention vampire. Her comment that stuck out to me the most was, "Not good enough, I will never have children or marry. I will never know what it's like to have a family." To me, this points to one of two things: either she is contemplating her prison incarceration, or she has a deep-seated hatred and low self-worth towards herself. I wonder if she had a miscarriage, or a long-term relationship breakup. Maybe she had an abortion at her partner's request. As of right now, we do not know for sure if there was an event that could have triggered Lucy to do these horrific acts, but I can say that, based on the evidence that has been given so far, I personally believe Lucy Letby could have an attention-seeking desire or a desire to cause others grief. A desire to cause others grief is often evident in cases involving revenge or jealousy. Most of the time, cases with a motive of causing someone pain include separating, ex, or divorced spouses. In cases like this, murder is used as a way to get back at someone. I do believe that Lucy probably suffers from a cluster B personality disorder or Munchausen syndrome by proxy. It's hard to diagnose or speculate someone's mental health without a significant behavioral background. People with Munchausen syndrome and histrionic personality disorder thrive on other people's attention. Based on the evidence available, I believe Lucy Letby thrived on the family's grief and reliving what she had done. Perhaps this is why she had such a focus on twins. Maybe she left one alive so that she would know the families of the victims would have a constant reminder of their loss. It's possible that she wanted to see what her victims looked like as they grew up, and an identical twin would be her perfect opportunity to do so. This path leads me to believe that Lucy Letby was a more sadistic type of serial killer. This type of serial killer is one who thrives on pain and causing fear, like BTK and Richard Ramirez. Perhaps this is why she called herself evil. Only time will tell why Lucy Letby did what she is alleged of doing. Hopefully soon we will have a mental analysis of Lucy Letby, or at least a mental history, to understand more about how this fresh-faced innocent-looking monster was created.